Hello everyone, welcome to my class today. Today we'll see a topic in nervous system, that is myasthenia gravis. So if you are the first time watching my video, please like, share, subscribe and click the notification button and stay tuned. So coming to the condition myasthenia gravis, so it occurs because of some problem in the nerve endings, that is where the nerve will end in a muscle. Okay, so this area where the nerve is ending in a muscle, the junction is called as neuromuscular junction, and in between the neuromuscular junction there are receptors called acetylcholine receptors. These acetylcholine receptors are responsible for releasing the acetylcholine. So whenever there is some problem occurs, the acetylcholine is not secreted properly because of the muscle contraction and muscle action is lost, and that condition is called myasthenia gravis. Okay, so in definition, so it is a neuromuscular disorder where there is weakness of skeletal muscles. So these skeletal muscles are responsible for movement. So when there is weakness, they cannot move, and this is caused because there is problem in the communication between the nerve cells and the muscles. In this disease, patient cannot do the crucial muscle activities and they will go for muscular weakness. Okay, into the causes of myasthenia gravis. So first is autoantibodies. So autoantibodies are antibodies that can destroy our own body cells. Okay, so in certain times these autoantibodies are produced in our body which will destroy a protein called muscle specific receptor tyrosine kinase. These are responsible for stimulating the production of acetylcholine, which is a neurotransmitter in between the neuromuscular junction. So when the antibodies destroy the protein will not stimulate the production of acetylcholine. So at that time patient can result in myasthenia gravis. Next is thymus gland. So when there is any disease of thymus gland or a tumor in the thymus gland, so the tumor in thymus gland is called as thymoma, and this thymus gland is responsible for producing the antibodies. When they are produced in an abnormal amount, they can destroy the acetylcholine receptors and thereby it can result in myasthenia gravis. And next is genetic factors. So genetic factors can cause neonatal myasthenia. So here the antibodies or the immune proteins that will attack the acetylcholine are getting transmitted from the mother to the fetus in the neonatal period itself, so which can result in myasthenia gravis. And age and ethnicity. So this myasthenia gravis can occur both male and female, and it is more common in young adult women under 40 and older men over 60. Okay, so it is more common in these age groups, but it can occur at any age. And coming to the pathophysiology, as I already said, there is some autoantibodies produced. So these autoantibodies will trigger the immune system and they will attack the acetylcholine receptors in the neuromuscular junction. So because of that, there is decreased number of acetylcholine receptor. So the main function of acetylcholine is to transmit the impulse and also produce the muscle action or the muscle contraction. So when the acetylcholine receptors are not there in an adequate amount, they cannot attach with the muscle and the muscle will lose the contraction and thereby patient will go for weakness. And coming to signs and symptoms, so most of the muscle activity, the voluntary activity of the muscles will be lost because the acetylcholine is not able to stimulate the muscles. Okay, so here eye, face, throat, neck, limb muscles, everything will get affected. So patient will have difficulty in speaking, which is dysarthria, difficult swallowing is dysphagia, and also difficulty in chewing because the muscles are not able to contract, and eyelids will get drooped, and this drooping of eyelids we can check with an ice pack test. So ice pack test is where the small ice pack will be kept in the eye for 2 minutes, and if the drooping is treated, is improved, then patient is having myasthenic symptoms. And double vision, which is diplopia, changes in facial expressions will be there, and speech will be very mild, like nasal speech will be there, and neck muscles will become weak, so patient cannot hold the head forward or backward, that is head will not be straight, and symptoms will be progressing over time and it can be very worse in the next few years, and patient will have worsened muscle weakness when they repeatedly do activity. And coming to diagnostic findings, so you have to do a neurological examination. Here you can see decreased reflexes, muscle strength, muscle tone are absent, and patient will have loss of sense of touch, and the gait, posture, coordination of movements will be lost, and balance and mental skills also will be impaired, and cranial nerve assessment will show problems with seeing or problems with the sensory and motor function you can identify in neurological examination. And antibody assay, so this is a blood test where we will check for the presence of antibodies. So you can see the antibodies that are attacking the acetylcholine receptors will be elevated in the blood. And tensilon test, so this test will prove if the patient is having myasthenia gravis. So here we have to inject intravenously tensilon. So after injection, if the weakness of the eye muscles and other symptoms temporarily improves, then it is myasthenia gravis. Okay, so because this drug will block the enzyme that will break down the acetylcholine, so that there will be transmission of impulses in the nerve endings. So patient will get improved when tensilon is injected, then it is called positive for myasthenic crisis. And other electrodiagnostic and imaging studies, so we do a nerve conduction study. So here electrodes will be kept on the skin where the nerves are going. So through this you can identify if there is a problem in the muscle contraction. So in myasthenic patients, the muscle fibers will be fatigued, so the waveform will be in flat waves will be seen. That is called nerve conduction study. So you can also do a repetitive stimulation of the nerve, which we'll see. So when we keep on stimulate the nerve, you can see gradually decreasing in the muscle function. Okay, and another test is single fiber electromyography. So here also electrodes are placed on a single nerve, and they will assess for the muscle function. So here the muscle fibers do not respond to the electrical stimulation, then we know it is a myasthenia gravis, that is the problem is there in the muscles. And CT scan, MRI chest will be done in order to identify if there is a thymoma, that is tumor of the thymus gland. And pulmonary function test will see if the patient is having any problems with the respiration, because if patient is in a severe myasthenic crisis, then the patient will have problems with swallowing, so aspiration can occur, and also problems in breathing can occur, problems in the pulmonary function, so that you can identify using pulmonary function test. And the treatment is pharmacological management. So here we will give cholinesterase inhibitor, that is pyridostigmine and neostigmine. So they will destroy the antibodies that are attacking the acetylcholine, so that they can improve the communication between the nerves and muscles, so muscle contraction will improve. And corticosteroids like prednisone, so this will inhibit the immune response. So I said antibodies are attacking the nerves, so they will inhibit this immune response, that is autoantibody production will be inhibited. And immunosuppressants, so as the name, they will suppress the immune system. So they give azathioprine, mycophenolate mofetil, cyclosporin, methotrexate and tacrolimus. These all will alter the immune system and decrease the antibody production. And monoclonal antibody, that is rituximab and eculizumab, these are the drugs which are recently used, and these drugs show that the patient is responding to myasthenia gravis. In nutritional therapy, you have to say them to eat small meals and snacks 5 to 6 times a day. That is, at a time patient will not be able to swallow, so slowly, gradually, like once in 2 hours, patient has to eat small meals, and avoid eating lemon or tonic water. So this can cause irritation, and further they can prevent the nerve strength. So we have to tell the person to avoid. And always tell them to eat warm rather than hot food, because patient will also have problem with sensation. So hot food can cause burning in the throat, so you have to tell them to eat warm food. And always tell them to eat liquid diet, like runny or puree like diet has to be given to improve the swallowing. And alternatively, that is, in between, patient has to take some swips of water, this to avoid the food sticking in the mouth. And also many dry crumbly foods which need more of chewing. Okay, so like more solid foods has to be avoided, because they need more of chewing. And next, coming to the main treatment, so they do a plasmapheresis. So here the patient's plasma is removed and it will be sent into a machine called centrifugal machine. So this centrifuge machine will divide the antibodies and the plasma. So from that the antibodies will be removed and the remaining blood will be transfused back into the patient's body. And while transfusing, we must also transfuse this albumin and other intravenous immunoglobulin, because all the antibodies are removed, then the patient's immune system will become low. So you have to again replace with IV intravenous immunoglobulin. Okay, so this intravenous immunoglobulin is a passive form of immunization where we passively introduce the immunoglobulin into the patient's body so that patient will have a normal immune system. And next is collaborative care. So as I already said, you have to take a healthy diet and also you have to avoid heavy weight, because the patient is taking more extra pound, it can have problems with breathing, etc. And also they can go for easy fatigue. So you have to tell them to take a healthy balanced diet. That means it should not have a overweight. And exercise, so exercise will boost energy, so you have to tell them to walk with assistance. If there is more shortness of breath or exhaustion, then it means they are doing a strenuous exercise. So you have to tell them to come down with the exercise. So gradually you can ask them to do yoga and chair exercises, isometric walking. All the exercises has to be advised. And manage stress. So for stress, you have to tell them to use relaxation technique, guided imagery, meditation, massage therapy will be used. And communication, so these patient when they feel isolated, they will be more stressed and also they can have more problems. So yeah, and also if they suddenly collapse or suddenly they have problem, then then patient can go for some crisis also, complications. So you have to tell them to communicate and maintain good relationship with others so that it will relieve isolation and stress. And trust spirituality, so that is every individual believes in God. So at time of illness, they think that if they pray, have some conversation with God, they will improve. Okay, so according to the religious belief, we have to advise them to do their spiritual orders. Okay, and then surgical management. So mainly here the thymus gland is producing the autoantibodies. We have to remove the thymus gland. So this thymus gland is present in the upper chest, so removal can be done. So nowadays there are robotic operations also, where the length of stay in hospital is less and also there is less bleeding and patient can also be easily recovered. And coming to nursing interventions, so you have to check for the vital signs, intake output chart, serum albumin, because when we do plasmapheresis with the antibodies, even the serum albumin protein will get removed. Okay, so patient need protein for building the body, so you have to see all the levels and daily weight has to be checked. And you have to maintain a patent airway, because patient will have problems swallowing, so you have to open airway, prevent aspiration, and all the emergency equipments like oxygen suction, amp bag, endotracheal intubations has to be kept at the bedside patient, because patient can go for crisis. And energy conservation measures, like at a stretch, patient should not do strenuous activities. He has to come down with the activities when he is exhausted or fatigued, so that we have to teach them. And physical therapy, so physical therapist can be consulted for any use of walkers and wheelchairs, and occupational therapists can also help in providing assistive devices for meeting the activities of daily living. And speech and language therapist has to be consulted if there is problem with communication. And continuously you have to monitor for signs of any myasthenic crisis and cholinergic crisis. Okay, so myasthenic crisis is when the myasthenic symptoms are very severe, then patient will have in myasthenic crisis. And when we keep treating the myasthenic crisis with the cholinergic inhibitors, then the patient, when we overly treat myasthenic crisis, patient will go for cholinergic crisis. Okay, so when we see complications, these two will be there. So myasthenic crisis is patient is not taking treatment, so the myasthenia has become very severe. So here you can see heart rate, BP, respiratory rate will be increased, bladder incontinence can be there, urine output will be decreased, and cough and swallow reflex will be absent, and patient may need mechanical ventilator, and patient will improve when we administer the drug called tensilon. Okay, so it is edraphonium chloride. In case of cholinergic crisis, this can occur because of over medication. That means when we overly treat for myasthenia using the cholinergic inhibitors, then the patient will go for cholinergic crisis. The symptoms are decreased BP, abdominal cramps, nausea, vomiting, diarrhea, blurred vision, pallor, facial muscle twitching, constriction of pimples. These are the symptoms. And during cholinergic crisis, if you administer tensilon, patient will have no effect. Okay, no change in the signs and symptoms will be there. Means the patient will improve only when the anticholinergic is administered, that is called atropine. Okay, and patient teaching, so you have to teach about all the disease condition, the signs and symptom, complication, and what has to be done when there is a complication, and also teach about medication use, dosage, etc. And signs and symptoms of these both myasthenic and cholinergic crisis has to be taught, and also tell the patient to plan daily activities and also maintain normal energy levels. That means strenuous activity should be avoided, and tell the patient where there will be fluctuations. Okay, so when patient is taking medications, patient may get treated. When he is not on medications, there will be exacerbation, that is excess signs of myasthenia can occur. So patient has to take the medication regularly, and strenuous exercise, stress or exposure to infection, exposure to hot and cold temperature should be avoided. Okay, because here muscle contraction will not be there, so patient will not be able to do excess activity, and also immune system will be suppressed, so infection, patient can get infection, and hot and cold temperature can be sensitive to the skin. Okay, and whenever patient is we teach regarding medication, if patient is on beta blockers, calcium channel, quinine, quinidine, procainamide, and some antibiotics or neuromuscular blocking agents, so these drugs can interfere with the myasthenic drugs. So you have to tell the patient to take with caution, and also consult the doctor before taking this drug. And D-penicillamine, A-interferon, and botulinum toxin should be strictly avoided when patient is on myasthenic treatment, because they can cause severe side effects and also may lead to death. Okay, so this is about today's class. I hope you have understood my class. Thank you for listening. Please like, share, subscribe, and click the notification button, and stay tuned. Thank you.